National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, my name is Dr. Jonathan Beatty, naturopathic doctor and a health expert here at Nationalnutrition.ca. Oftentimes in my practice, I encounter men that come to me with fatigue, loss of sex drive, low bone density, a number of different symptoms that may all be related to a decrease in testosterone. You see, men can develop a condition called andropause, which is characterized by a loss in testosterone. Testosterone is a very important hormone for growth and development, and as we lose testosterone, our tissues do not regenerate as easily or as quickly. This leads to, again, loss of bone mass. It can actually lead to dry, saggy skin. It leads to a loss of energy and can even account for a loss of sex drive and erectile dysfunction. Testosterone is a very important hormone to maintain, and the trouble is that men, as we age, we lose our testosterone production. So it's really important that we support it. Now, there are a couple ways that you can treat it. The more traditional approach is to actually prescribe men testosterone. In Canada, it is available only by prescription, and so you will need to consult with your physician to obtain it. That being said, I'm not a huge proponent of long-term testosterone use as a prescription. And the reason for that is the more you use testosterone, the more it can actually drive down your natural production. So what happens is you actually become dependent upon constant testosterone prescription, constant testosterone supplementation. There are some natural ways that you can actually approach this and restart your body's testosterone production. Not only that, but also increase your body's sensitivity to the testosterone you have. See, low testosterone isn't always just having a low level of it, and sometimes it can be a low response to the testosterone that you do produce. Some of the reasons this can happen is testosterone is only available to the cells when it is free. And a lot of the testosterone circulating in your body is bound to a protein called sex hormone binding globulin. So if you can reduce the amount of testosterone that's bound up, you can actually free up that testosterone for your cells to use. And even without increasing the testosterone levels, you can increase the testosterone response and the overall health of the individual. So some of the ways you can do this, there's a fabulous herb. It's called Tonkat Ali, sometimes known as Malaysian ginseng as well. Its Latin name is, it's a great one, I love saying it, Eurycomia longifolia Jack. Now this herb is really important because it's one of the only herbs that's ever been demonstrated to reduce the amount of bound testosterone, or thereby increase the free testosterone, as well as actually increasing testosterone levels. There are very few herbs that have ever been shown to do this. Tonkat Ali or Eurycomia longifolia Jack has been shown in multiple studies to actually increase testosterone levels. Now, in addition to that, you can increase your testosterone sensitivity. And one of the herbs that's best known for this is Tribulus terrestris, sometimes called just Tribulus, or sometimes known as Bulgarian puncture vine. Now this herb, it's a fabulous herb for increasing testosterone receptors at the level of the muscle or at the tissue level. What this does is it allows the cells to respond more appropriately or a stronger response to your testosterone, thus increasing your libido, improving the quality of your skin, increasing your energy, and actually potentially increasing your bone density. So basically reversing what happens with aging, reversing that loss of testosterone, reversing that cellular senescence. So it's really important that you make sure your testosterone levels are adequate. Now they do vary a lot. And there's different people have different responses. So when you are getting tested, make sure your doctor is testing both your free testosterone as well as your bound testosterone, so you can figure out how much of it is bound up. And then if you do start supplementing, you can actually monitor your body and see what changes you're making with your hormone levels. Are you having a positive impact, or is it time to find another strategy? Typically give yourself between 3 and 6 months with each strategy, just because with hormones, they are a little bit more longer acting, and it can take a little bit more time to actually get the effectiveness out of the herbs. In addition to the herbs, you might also consider using certain nutrients that are required for testosterone production. Zinc is very important, selenium is very important, and I always recommend a good B complex, as B complex or the B vitamins are responsible for the metabolism of testosterone in the body, and ensuring adequate B vitamin levels ensures adequate testosterone production. Other ways you can help manage testosterone: improving the way your body eliminates bad testosterones or your testosterone metabolites. This can be done by ensuring you take in lots of bitter vegetables in your diet, things that help your body metabolize and excrete hormones. Specifically, the broccoli family of vegetables seems to have an added benefit of this. So just increasing that family, or what's called the brassica vegetables in your diet, can actually help to manage your testosterone levels, as well as actually your estrogen, because of course testosterone and estrogen do work in a balance, and when you sometimes lose testosterone, you actually increase your estrogen, thereby increasing your estrogen response. So dietarily managing that as well can be effective. And for that, sometimes in men, reducing the amount of soy they intake, as soy can sometimes contain estrogen-like compounds, and those affect some men more than others, but they can be actually part of the problem. So excessive soy intake, I have seen in my practice, associated with andropause symptoms, and actually when the person stopped consuming soy, all of their hormone, their low testosterone symptoms went away without having to supplement the testosterone. So that's one of the ways diet can help change your andropause symptoms. So I hope you've learned a lot today about andropause and some of the things you can do to help manage the symptoms of andropause or low testosterone and find a little bit more vitality in your life. So if you've liked this video, please go to our channel, check out more of the natural health videos. You can subscribe, and if you have any questions or comments, feel free to post them below. And always remember that knowledge is health.